so the PCICU and the PICU is a combined unit. So we get to see both cardiac and medical patients on the same unit, on the same floor. From the medical side, we get to see your bread and butter, your DKAs, your respiratory kids who come in distress, versus other kids with other genetic or other more complicated pathologies where you have to do a lot of investigative stuff, and we have a good team, like consultation team here, that we're able to figure that out. And then on the cardiac side, we do get to see a lot of children with different types of cardiac anatomies, which you wouldn't usually kind of think about it, but it's a very good mixed population that we see here.
Each year, in your first year, you do a lot of service months, and so you just kind of get your feet wet, get to know a lot about just how things run, how to manage your bread and butter, how to manage a sick patient, getting through all of that stuff. The second year, you start more getting introduced into more of like that leadership, like trying to own the unit. You also start to do your shock trauma rotation, which is a great rotation. I loved it a lot. There's no better way to practice trauma than to just do it again and again and again, and adults get into a lot more trauma than kids do. Our third year is really focused on being an attending, and so we're kind of shifting it, so instead of just having like one pretending month, we actually end up the whole time the attendings are supposed to start backing off, letting you run the unit, and you learn how to manage a whole sick unit rather than just managing a couple of sick patients.
I chose this fellowship program here at University of Maryland because of, one, the size of the unit. So I trained in a more medium-sized unit, and I found that this unit here was small enough and medium-sized enough to be able to work closely with my co-workers and my colleagues. And then of course during the interview process, everybody was very friendly and welcoming, and I think I wanted to be in a place where I could feel comfortable working with people. And then the other thing is that I have a big interest in global health medicine, and we have a lot of attendants here who work in that field, and I knew that I would have great opportunities to get into that and kind of grow and kind of think about where my career goes from here.
The one thing that that brought me to this program that I just want to highlight again is that this program is a smaller program. There's only 4 fellows, but because of that, it's very individualized. And so some people need a little bit more support, kind of getting started, getting their feet wet, and moving forward to get through it. And then some people hit the ground running, and they just want some autonomy to get through it, to make mistakes, but of course carefully with supervision to make sure the patient doesn't get hurt, but just to really start running through it. And because we are a smaller program, you can do whichever way works for you, like whatever path of learning is best for you. The program customizes it that way.
For me, pediatric critical care is something that I think is important to me, and just in general, is that this is the time where patients are the most critical, the most vulnerable, and I think it's a privilege and an honor to be able to take care of these patients and these families when they are scared and they don't know what's going to happen next, and they're able to put their trust in you. So I really enjoyed that interaction and that relationship that we get to build with the families. And of course with critical care, it's a lot of trying to figure out what is going on and trying to diagnose and put the puzzle pieces together, which is something that I enjoy.